and how we can write a nice methodology or research methodology in our thesis or in our scientific paper. So let's start. So first of all, what is research? So it's very simple that research, it has two terms. Re plus search means search again. So research is to search again. And why we search again? To arrive at something novel. We don't know about that, so it's a novel. So to arrive, to achieve something novel. So we know that research means a systematic investigation or careful study of a subject, of a topic, especially in order to discover new fact, new information about it through investigation or search. So this is a research, a systematic scientific investigations. So we can find out a solution for a question. And that is a research question or research problem. When we talk about methodology in a dictionary, so in dictionary, it is a way of doing something based on particular principles. So methodology, we have to follow some principles and to achieve our goal, our outcome in research. And in Wikipedia, so it is a structured procedure. It's a structured, it's not unstructured, it's a structured procedure for bringing about a certain goal. So what is goal? Goal is our outcome, our aim of the study, our objective of the research study. So through this methodology or research methodology, we will achieve our objectives, our goal, our aim. So now what is the research methodology? Research methodology is structured as we have already discussed, and scientific approach
Excuse me, sir. Your voice is not audible, sir. Kindly unmute yourself.
Now, am I audible, ma'am?
You are audible, sir. You are audible.
Okay. So we have left, or I just start from this or previous slide? Is it okay? I can start from here?
Sir, you start with the previous slide.
Yeah. Yes. From here?
Yes, sir. Just third point. Start from
okay.
Third. Yes, sir.
So as we know that research is re plus search means search again to arrive to achieve something novel. And research means a systematic, a scientific investigations or careful study of a subject or topic, whatever our topic or study, especially in order to discover new fact, new information, new innovations about it through investigation or search. And when we talk about methodology in dictionary, so methodology is a way of doing something and which is based on particular principles. So we have to follow some basic principles in methodology. And when we talk about in Wikipedia, so it is a structured procedure. It's not unstructured. It's a structured procedure for bringing about a certain goal. And what is goal? Goal is our research objective, research outcome. So by using this methodology, we can achieve our research objective, research aim, research hypothesis, or research outcome. So now research methodology. So it is a structured we have already discussed about, and scientific approach, scientific principles behind this, and used to collect analyze and interpret quantitative or qualitative data. So what is quantitative data? These are height, weight, BMI, HB, systolic BP, diastolic BP. And what is qualitative data? Qualitative data is male or female, religion, categorical data. So we have to interpret, we have to collect, we have to, after collecting, we have to analyzing, and after analyzing, we have to interpret these data, quantitative or qualitative, to answer research questions or test our hypothesis. And a research methodology is like a plan, okay, for carrying out research and helps keep research on track. So by using research methodology, we can achieve our goals, keeping in track, okay? The research methodology section in a thesis or in our scientific paper describes the different methodological choices made, or that includes data collection and analysis methods. So in definition, the research methodology is the specific procedures or techniques used to identify, select, process, and analyze gathered or collected information about a research topic or research questions. And research methodology follow specific scientific principles we have already discussed, and it is the science of study of how research is done systematically. So there is a scientific principles and there is a system is going on. Without system, we cannot get our objective. And the research methodology section answer two main questions in our thesis, in our research. And what is, how was the data collected or generated, and how was it analyzed? So data collection, data generation, and how we can analyze these data so that we can interpret our results and we can generalize our research study results. So this is research methodology. Basically, there are three types of research methodology, and mainly these are not research methodology as such, these are research approach. And based on these approach, we follow research methodology. So number one is qualitative, number two is quantitative, and when we do qualitative and quantitative mix, it's called mixed method research. So in qualitative research, researchers investigates human experience and behavior through non-numerical data collection, and after collection there is an analysis and interpretation. And in quantitative research examines relationship between independent and dependent variable using numerical data and statistical technique we have to follow. And when we talk about mixed method research, so we have to use both technique, qualitative and quantitative, and after we interpret, we analyze and we interpret and we generalize the findings in a single research. So it's called mixed method research. These are the component of a research methodology. And research methodology includes, number one is a research approach. Which approach we have to follow? Qualitative, either quantitative, or either mixed type of research approach. Then research design. So in particular research approach, there is a research designs. For example, in quantitative research, approach, there is descriptive design, there is exploratory design, there is a case control design, experimental design, quasi-experimental design, randomized control designs. So which design we have to use to achieve our goal, achieve our to interpret our results and to achieve our outcome. In qualitative research, the research design is mainly phenomenological research design, and ethnographic and grounded theory. And in qualitative research approach or research methodology, we have to generate theory, we have to generate theme, sub-themes, and we have to generate theories. And mixed method research design or research methodology. So the research designs are convergent parallel research design. There is a explanatory sequential research design, and there is exploratory sequential research design. So according to our outcome, according to our research problem, our hypothesis, we have to choose this research design. Now, area of the study or study setting. So where we have to conduct, in hospital or in community. In hospital, where conduct, for example, in urology setting, in eye ophthalmic setting, in OPD setting, in like ward setting, bedside setting. So we have to mention clearly in area of study or study setting. Then population of study. So for whom and to whom we have to conduct this study. For example, in stroke patient, for example, in HIV patients. And in population of study, there are two type of population. Number one is target population, and number two is accessible population. So in coming slides, we will discuss detail about these things. Now comes to sample and sampling techniques. So we know very well in this, there are two type of sampling technique: probability sampling technique, non-probability sampling technique. In probability sampling technique, every subject has equal chance to be selected as a sample, and in non-probability sampling technique, everybody has no equal chance to be selected as a sample. We know about this. In probability, there is a simple randomization, systematic randomization, cluster randomization. In non-probability sampling, there is a purposive sampling, there is a quota sampling, there is a total enumeration sampling technique. According to our research or according to our question, we have to select this sampling technique. Then instrumentation means research tool, questionnaire, observational. So what research tool we have to use? So this comes in instrumentation or research tool. Now, administration of instrumentation means method of data collection. That is method of data collection. How we collect data, and then after that, this is a data analysis. Inferential statistics, descriptive statistics, which statistics we have to use or we have to apply to answer our research questions. And this is and in research methodology, there is an ethical consideration. So there are some certain ethical principles we have to follow, and we have to follow these certain ethical principles, guidelines. We have to. There is a confidentiality, there is a anonymity, there is a written consent, there is like information sheet we have to give, there is a willingness, there is a no harm. So we have to follow these ethical principles in. So it comes under research methodology. A researcher has to mention all or elaborate or write down in detail about these components in their thesis or in their scientific paper. So how to write a research methodology? So we have already discussed about all these things like research method or approach, research designs. We have done. target population, accessible population, I explain with example these things. And now inclusion and exclusion criteria, we have to explain, and these are the main characteristic of the included and excluded study participants. And please, every time in inclusion criteria, we have to return the patients or participants who willing to study or who give informed written consent will be included in our study. Okay. Now sampling technique we have explained, and sample size calculation, it is very essential. So there are different sample size formula. There is a sample size formula, and so we have to collect these sample size formula according using this sample size calculation using this formula. For descriptive study, there is a different type of sample size formula. There is RCT, there is a different type of, there is a correlation study, there is a different type of sample size calculation formula. For qualitative study, it is like mentioned that till their data saturation, we have to collect our samples. We have to recruit our sample. So these are data collection methods, research tools, statistical analysis. We have already described in detail, discussed in detail, and there is a research delimitations. So what is the research delimitations? So it is mention any limitations the researcher foresee while conducting their research study. For example, the main research delimitation is time limitation, because we don't have, or researcher don't sufficient time, 2 years, 3 years, 4 years. We have only 10 days, 15 days, or more only 1 month or 2 months, not more than 2 months. So this is our research delimitation, and we have to mention. And we are doing study in mainly single center study. So it is also our research delimitation, and we have to mention it is only single center study. So it is our delimitation. And ethical consideration, we have already discussed about this. So there are some example and of quantitative research methodology. So in this, I just explain about how to write research methodology in quantitative research approach or research design. So this is the title of the study, and it was conducted at our center, and a descriptive study to assess the equipped status of ambulances, awareness and practices regarding cardiopulmonary resuscitation among staff of ambulance bringing patient to PGI-MER Chandigarh in 2018-19. So it is our research problem or research statement. And these are objectives. And number one objective is to assess the equipped status of ambulances bringing patient to PGI Chandigarh. And number two, to assess the awareness and practices regarding CPR among staffs of ambulances bringing patients to PGI-MER Chandigarh. So this is outline of research methodology for this thesis or study. So number one is it is a plan or flow chart. So research approach is quantitative. Research design is a descriptive design, and number third is a research setting, and these are connected with these down arrows. Okay, the boxes are connected with down arrows. So this is a research setting. It is Advanced Trauma Center, PGI-MER Chandigarh, Nehru Hospital, PGI-MER Chandigarh, Advanced Pediatric Center, PGI-MER Chandigarh, because the researcher have to collect data from the staff of ambulances who bring the patient on these centers. And our target population is staff of ambulances. So we have to think universe, staff of ambulance in this universe. Okay, so it's our target population, staff of ambulance. And what is our accessible population? Staff of ambulance bringing patient to Nehru Hospital emergency, Advanced Trauma Center emergency, Advanced Pediatric Center emergency, PGI, MER Chandigarh, and collected or enrolled during data collection period. So it is our accessible population, and our target population is just staff of ambulance all over the India or all over the world. This is our target population. And it is what is about inclusion criteria. So the staff of ambulances who are giving, who gave written informed consent for this study, who are willing to participate in this study. And there is no any exclusion criteria in this, okay? Now, sampling technique. So we included this, we selected this purposive sampling technique. So what is our purpose? Our purpose is our objectives. So according to objective, we have to select the sampling technique, and which is purposive sampling technique. And now sample size, so it's around 400. We calculated sample size using formula, and we put here. Then tools for data collection, we used questionnaire as a data collection or interview schedule as a data collection, whatever. And this include 3 parts, consisted of 3 parts. Part A, just socio-demographic data of staff in ambulance. Part B, checklist for medical equipment available in ambulance. And part C, assessment of knowledge and practices regarding cardiopulmonary resuscitation. Now comes to ethical clearance. So we have to mention that clearance from ethics committee of 9R Center, PGI MER Chandigarh, like researcher got this clearance, and informed written consent from the participants. So these are the like main things of ethical consideration. And after that, there is a method of data collection, questionnaire, observation, interview schedule, and now analysis and interpretation, that is the descriptive and inferential statistics we have to use to analyze and interpret the findings. And for publication, for generalizability or like communication, we have to publish this article, and we published this article in this journal, Nursing and Midwifery Research Journal. And the title of this, a study to assess the knowledge regarding CPR among staff of ambulance, equipped status of ambulance, and their utilization. And in this published article, this is methods and material. In methods and material, our research methodology is explained step by step. And this is a sample size calculation to calculate sample size using this Cochrane formula. So we have to mention each and everything. And in statistical analysis, we use this SPSS software, and everything we have to mention here. So this is in paper research methodology. And this is ongoing RCT. So research methodology in the randomized controlled trial or quasi-experimental study or design. So title of the study, randomized controlled trial to assess the effectiveness of urinary catheter care package on catheter care practices among caregiver and quality of life among patients with long-term indwelling urinary catheter attending urology units PGI MER Chandigarh 2023 and 24. This study is still going on, and we can see that we can identify what is our research setting, what is our target population, what is our accessible population. We can identify, and what is research design, we can identify by just seeing this title of the study. And these are the objective, and objective number 1 is to assess the period prevalence of catheter associated urinary tract infection, that is COTI, among patients with long-term indwelling urinary catheter. And number 2, to develop and implement a urinary catheter care package on patients with long-term indwelling urinary catheter attending urology units PGIMER Chandigarh. And number third, to assess the effectiveness of this package on catheter care practices among caregivers and quality of life among patients with long-term indwelling urinary catheter attending urology units PGIMER Chandigarh. And we have to operationally define what is OT, what is long-term urinary indwelling catheter, and what is UCCP, that is urinary catheter care package, and what is caregiver of these patients. So we have to operationally define this, and we have to make hypothesis for this. And we know that very well about null and alternate hypothesis. So our alternate hypothesis is also known as research hypothesis. And there are mainly two aspects here. Number one is urinary catheter care practices among caregiver. And number two is quality of life among patients with long-term indwelling catheter. Okay, so we have to make according to this. There are two null hypotheses and there are two alternate hypotheses. So one for urinary catheter care practices among caregiver and one for quality of life among patients with long-term indwelling catheter. So we have to make null hypothesis or alternate hypothesis according to our objectives. So now, according to number of objective, we have to make null or alternate hypothesis. If our objective is 1, so we have to make one null hypothesis or single alternate hypothesis. If our main objective is 2, then we have to make 2 null hypotheses or 2 alternate hypotheses, so on. So this is outline of research methodology of RCT. So number 1 is research approach. We know that this is a quantitative research approach. Research design, we know that it's a randomized controlled trial. And research setting, urology units, PGIMER Chandigarh, and target population, patients with long-term indwelling urinary catheter and their caregivers. So both are patients and caregivers. These are our target population. And what is accessible population? Patients with long-term indwelling urinary catheter and their caregivers attending urology units, PGIMER Chandigarh, from this to this. This is our data collection period. And these inclusion criteria and these are the exclusion criteria. We have to mention. And after this is a ethical consideration. So we have to mention about the what is benefit to do this study, ethical clearance taken from ethics committee, permission was taken from the head department of urology, informed written consent was obtained from each participant, and participant information sheet was given to each participant. So these are our ethical consideration we have to follow. Now, sampling technique, as I told you, it's a total enumeration sampling technique, and total enumeration, whole population we have to include during this data collection period. We have to include. For sample size 100, and we calculated the sample size using software, and we use day-wise randomization. And like, for example, first day we have to recruit all control patients, and second day we have to recruit all for example, or experimental or intervention patients, because it like minimize the bias or contamination. We have to think about. And after this randomization, we have to like segregate patient into control group and experiment group. And in control group, at baseline assessment, we did these like point prevalence of period prevalence of the COTI, catheter care practices among caregivers, and quality of life among patients. And the experiment group, we did same things. And we follow this method of data collection. We use interview schedule, assessment, observation, records, and reports. And after that, these are the tools for data collection. So this is interview schedule and consisted of following parts. So we have to mention each one. in this flow diagram or in this plan. And then we use this protocol, and this is a urinary catheter care package for patients with long-term indwelling catheter and their caregivers. And in experiment group, we use this protocol with the routine care. And in control group, we just give routine care. And after this, we post-assessment was done at 2 weeks after enrollment in the study by face-to-face interview, physical assessment, or by telephonic calls if patient or caregivers were unable to come to our like OPD. And now after that, this is a data analysis or interpretation, same descriptive and inferential statistics. And after that, this is a dissemination of finding. We have to report writing, presentation, and publication. Presentation I'm just doing, and publication after this like thesis submission, we have to do publication for this for generalizability. So why is the research methodology important? So I have given two examples, quantitative, one is descriptive, and number two is RCT. So why is the research methodology is so important? So it helps researchers, other researchers, other than you, who may want to replicate these findings or research. The explanation will be of benefit to them. So if they follow same research methodology, they will get same or replicate same findings. A research methodology provide a framework and guidelines for researchers to clearly define research questions, hypotheses, objectives, and etc. And it helps researchers identify the most appropriate research design in qualitative, in quantitative, and mixed method, sampling technique, data collection, and data analysis methods. A sound research methodology helps researchers ensure that their findings are valid and reliable and free from biases and errors, minimum bias. And it also helps ensure that ethical guidelines must be followed while conducting research. Good research methodology help researcher in planning their research efficiently by ensuring optimum usage of their time and resources. So these are references from where I took this presentation. Thank you. And if you have any question, you can ask me. It's a short and sweet presentation. So if you have any question, you can ask me. Thank you.
Thank you, sir. Anyone having any doubt? Participant, kindly ask your doubt. Any clarity you needed for the methodology or the types of research? They may ask.